Everybody, it's Dr. Alex Earl here at Pure Plastic Surgery, and we are live. It is Hump Day with Dr. Alex Earl, and this is the time we get to spend with you guys going over plastic surgery subjects and, of course, answering all your plastic surgery related questions, okay? And today, as we have done for the past few weeks, we are on YouTube, Instagram, and TikTok. All right, a big shout out to all our TikTok players, which we just started doing very recently. All right, so Instagram, that's where I've been on the most. That's where I have the most followers as well. But they know me, and a lot of them have gotten these questions answered. But TikTok, you're relatively new. Haven't done a lot of lives on TikTok, so the way this works is that I'm going to go over a very important topic, and then of course feel free to ask me any question related to plastic surgery, whether it's about pre-op, the surgery itself, post-op, head to toe. I'm happy to answer it for you. Okay. All right, so this was a very actually interesting question that came to us after a post that we did not too long ago, and it really surprised me because I've been talking about this, at least on social media. I've been probably talking about this for about 4 years now, but we got this question. We didn't even get it from one person. We got it from quite a few people, and the question was, what is a safe BBL? And I was a little kind of flabbergasted that we got this question, and it seems like it would be like a very easy or straightforward answer, but it's not. Actually, there's a lot of things that go into making a safe BBL, and of course that's what we do here at Pure Plastic Surgery. We do a safe BBL, we do an ultrasound guided BBL, and this applies to all BBLs that we do, even our own very special, very signature South Beach butt lift or so BBL. Okay, so the question is, what is a safe BBL? And I'm sure there's a lot of people out there, a lot of people that have read the news and social media and stuff like that. There's some people out there probably saying there's no such thing. There's no such thing as a safe BBL. And I'm here to tell you that that answer would be wrong. But there is such a thing as an unsafe BBL and a safe BBL. And that's what we're going to delve into right now. So what can we do to make this procedure safe for our patients, okay? And why do we ask this question? Because as many of you know, back in 2017, the mortality rate for this procedure was very high. It was 1 in 3,000, which was way higher than any cosmetic procedure being done at the time. But after several things have gone through, we've been able to lower that mortality rate, and we're going to talk about that as I move along. Okay, so what is the first step to having a safe BBL? Well, you have to have the right patient. You can't do this procedure on just anyone, okay? Simply because somebody wants a BBL does not mean that they qualify for a BBL, okay? So of course the patient has to be within a reasonable BMI. Your BMI cannot be too high, otherwise the risk of complications goes way up. And so we definitely would not want to do anyone with a BMI that's greater than 35 for sure. Okay, 35, once you're above 35, you're considered what we call morbidly obese, okay? And that's a medical term that I'm using, all right? And that means that if you have surgery under general anesthesia, your complication rate is going to be quite a bit higher than the general population. And these are for serious complications, okay? We're talking about blood clots, okay? Your deep vein thrombosis, which is a clot in the legs, and your pulmonary embolus, clot traveling to the lungs. Pulmonary embolus can lead you to be in the ICU, so in the hospital, in the ICU, or even death, okay? And your risk goes way higher for that. As well as, risk for more common things like wound infections, okay? Is higher when you're morbidly obese, okay? So I would not recommend that anyone in any center in any country have a BBL if their BMI is higher than 35. What you need to do is weight loss, which you can try to do through diet and exercise if you're very motivated, or you can do through bariatric surgery, get your gastric sleeve, your gastric bypass, whatever you need to lower that weight and get down. But me personally, my max is a BMI of 30. That's my max, okay? Why? Because that's even safer. So, so normal BMI is somewhere between 18 and 25. That's what we consider normal. Okay, then 25 to 30, we consider that to be overweight. Above 30 is considered to be obese, and like I said before, above 35 is considered to be morbidly obese. Okay, so if you're above 30, that's when complication rates start to tick up. Of course, not as high as when you're 35. It's not a linear curve. It's like it goes up like this, right? So it's very, very steady. Then you go to 30, starts to go up. Once you get to 35, it goes up this way. If you can visualize that graph in your head. Okay, so start with reasonable BMI patient, and of course the patient needs to be healthy. You cannot have a whole bunch of medical issues going on. If you have, for example, high blood pressure, it needs to be controlled. If you have diabetes, again, it needs to be controlled. We're going to check that by checking your sugar levels and your hemoglobin A1C to make sure that you have stable, glucose levels throughout. Okay, so you need a healthy patient. You need a reasonable BMI patient. You need the hemoglobin level to be ideally greater or equal to 12. Okay, so you want that to be ideally greater or equal to 12 before you get started. Now we do some patients with a hemoglobin of 11, but 11 is the absolute cutoff. Any hemoglobin lower than 11 for any reason, you should not be doing this procedure. Okay, so I know unfortunately we get a lot of patients that have like thalassemia, and that's a blood disorder that keeps your hemoglobin levels low. And a lot of times they have a lot of trouble getting it up. And unfortunately, if you can't get it to 11 or higher, we're not going to be able to do this procedure for your safety. Okay? All right, so reasonable BMI, healthy patient, hemoglobin level ideally 12 and higher. If your hemoglobin level is kind of teetering along there and you want to get it higher, then you've got to start your iron supplements. So make sure you're on vitamin C, folic acid, your Hemaplex, and your Fluoridex. Okay? And the last one, which I didn't really put on here, but complications rates for this procedure start going up after the age of 50, certainly the age of 55. So my cutoff for age for this procedure specifically is 50, okay? And that's because in my experience, I've seen patients that are over that age, they have a lot tougher recovery and a higher chance to end up in the hospital for, whether it's dehydration, fainting spells, blood transfusions, etc. So my cutoff age is 50. All right. So that's on the patient side, okay? That's the first thing that's really, really important there. And of course, you got to go to the surgeon side. So who is this person that's operating you, right? Who's this person you're trusting your life to? Okay, you got to think about it that way. You just can't go to some center, some high volume center like the ones we have here in Miami, and not even know who's operating on you, not know their background, their training, their experience, or any of that, okay? So you have to research your surgeon. All right, and you can do a lot of that online. First of all, first thing you're going to check is if they have an active medical license. All right, you do that online. Then you're going to check what their board certification is. All right, ideally they'll be board certified by the American Board of Plastic Surgery. So you want to check their training and their experience. Okay, how many BBLs have they done? Have they done them safely? Have they had issues or complications or patient deaths or anything like that? Okay, you definitely want to look into that. All right. So one of the things that I can tell you, for example, here at Pure, of course, I'm double board certified. I am board certified by the American Board of Plastic Surgery. I have done over 3,000 BBLs, approximately 2,000 of those under ultrasound guidance. Probably the most that have been done under ultrasound guidance in the United States. Okay. So a ton of experience with this procedure. And the other thing you should try to look into, and you can look this up on the web as well, is whether your surgeon is a WAGS member. What is WAGS? Well, WAGS is the World Association of Gluteal Surgeons, okay? This is a society where we focus on this procedure, gluteal procedures in general, mostly about BBL, sometimes about implants, okay? And we have very specific guidelines for our members as to how to perform this procedure safely. Not only that, but we have training centers, one of which is here at Pure. So I had the first WAGS ultrasound guided gluteal fat transfer training center, and now there's others throughout the nation where we train our members and train others how to perform this procedure safely under ultrasound guidance. Okay, incredibly important. So you can go to the website for WAGS, the World Association of Gluteal Surgeons, and see if your surgeon is a member of this society, because that means that they have gone through very strict protocols, they're taking very strict guidelines, and they've probably done some ultrasound training to do this procedure, which has increased their safety profile. Okay? So you're going to check on your surgeon. The next thing you're going to check is how many cases is this surgeon doing a day? That has to be reasonable, guys, okay? Yeah, I mean, if they're only doing one a day, I mean, maybe they don't have as much experience, that's fine. But, I think what is reasonable is probably 5 or less. Okay, anyone who's doing 10, 12, 15 cases a day, that's not reasonable for this procedure. Okay, you are going to get into what we call surgeon fatigue, and then because of this fatigue, mistakes can be made and complication rates can go up. Okay, so what is reasonable? In my view, I think 5 or less is reasonable. Okay, anything more starts to get unreasonable. So you want to check with your surgeon how many are they doing in a day, and that volume needs to be reasonable. Okay, all right. Now we jump into the clinic itself. Like, where is this procedure getting done? Is it getting done in the hospital setting? Is it getting done in an ambulatory surgery center, or is it getting done in an office-based surgery center? Okay, and then you want to check the certification for that center. So what we have here, Pure is an office-based surgery center. All right, and there's different levels of certification. The highest level is what we call the Joint Commission. Okay, so JACO is the highest level, and that's probably the most ideal. And then, of course, the baseline level is being certified by the Florida Department of Health. All right, so they have at the very least, they have to be certified by the Florida Department of Health. Otherwise, that means that place is not certified to do surgery at all, and you should not go there. Okay, so make sure you check your clinic. Make sure you check that the certification, and if they have JACO, that is the top certification. That is the most ideal. All right. Okay, so surgery, of course, the surgeon is important, but the anesthesia providers are really, really important as well. All right, so just make sure that it can be anesthesiologists or CRNAs. CRNAs are wonderful as well. All right, but just make sure that they have experience, and specifically with this procedure. Okay. All right. Now we get to the surgery itself. What can you do in the surgery itself to make sure that it's safer? And that's by placing the fat strictly in the subcutaneous plane. Okay, so this is the plane that's between the muscle and the skin. All right, that is the safe space. If you go deep, if you go into or deep to the muscle, that is not safe. That is a danger zone. All right, why is that? Because when you go into or deep to the muscle, that is where you're going to have these big blood vessels, what we call the superior and inferior gluteal vessels. And if those get injured and fat get in those vessels, that's when you're going to have what's called the fat embolism. The fat travels to the lungs, okay, and the patient can die. The patient can pass away. All right, so it's extremely serious. So you want to go to a surgeon that strictly places fat in the subcutaneous space, okay? Do not try to get it all at once. There's some patients, they may say, I just want to do one round. I don't want to have more than one round. I want to place as much fat as possible. I don't care. I'm going to go to, wherever it is, somewhere else, Dominican Republic, Colombia, or wherever, and they're going to place it in the muscle. I'm going to take my chances. That's like playing Russian roulette. Don't do that. Okay, the mortality rate, that's when you get this mortality rate here, extremely high, 1 in 3,000, when you're placing the fat into or deep to the muscle. Okay? So how do you know? Well, how do you know you're in that subcutaneous space? How do you know for sure? All right, because we're placing this big long cannula underneath the skin in a blind procedure. Well, what do? You turn a blind procedure to one where you can see, right? And that's where the ultrasound comes in. And that's what we do here at Pure. I've been doing it since 2019. Okay? That's when you use ultrasound imaging technology so you can actually see the cannula. You can see the different layers of the buttock, the skin, the subcutaneous space, and the muscle. And you can make sure that your cannula is in that safe space and that you're placing the fat in that safe space only. All right? And that's what really increases the safety profile of this procedure. And that combined with everything else is what makes a safe BBL. Okay? So guess what? We started with a mortality rate of 1 in 3,000, way too high. We started focusing on placing the fat in the subcutaneous space. That brought it down to about 1 in 15,000, which is equivalent to what a tummy tuck would be. So now on par with other cosmetic procedures that we do. All right. If you are a WAGS member, and we've done this study with our members that are not only in the U.S., they're in the U.S. and throughout the world. That's why it's the World Association of Gluteal Surgeons. All right. So Central, South America, Canada, Europe. All right. Everywhere. If you're a WAGS member, based on our numbers from our membership, the mortality rate goes down even lower to 1 in 25,000. And here's the kicker. If you're a WAGS member who uses ultrasound, goes all the way down to 1 in 50,000, making it a safe BBL. All right, not only am I a WAGS member, I'm the president of the World Association of Gluteal Surgeons, okay? And I've had the most experience with ultrasound-guided BBL. All right, so my question for you is, after listening to me for the past, 10 minutes, 15 minutes?
15 minutes, 57 seconds.
All right, after listening to talk for the past 15 minutes, okay, you're considering a BBL, the question is, what would you choose? Are you going to choose a unsafe BBL and play Russian roulette? Or are you going to choose a safe BBL? And I think, of course, the answer is obvious. All right, you want to go to a place that has all of these things going on to make sure that you get back home to your family. All right, and now happy to answer any questions you guys may have.
Well, we have a lot.
All right, let's do it.
Yes, Doug, this is a lot of questions. So, is there an ideal age range for a BBL? I'm 26.
You're 26?
Yes.
Yeah, so 26 is great. So ideal age range, at least for me personally, is between 18, because I don't do what we consider pediatric patients, so it has to be an adult. So 18 to 50, I think would be the ideal range. And if you want to talk about the most ideal range, yeah, it's going to be in that middle part. It's going to be between like 20 and 40.
How long after surgery should you wait to have sex?
That's a great question, and a lot of patients get embarrassed. They don't want to ask. They're like, "Oh, should I ask?" and this and that. So it's a great question. I'm so glad you asked here. And so you want to wait at least 6 weeks. All right. So in the first 6 weeks, you're not supposed to be doing any strenuous activity, and so that includes sex. All right. So you want to wait 6 weeks before any sexual activity.
Okay, now let's go to YouTube. There are some questions here too.
All right.
And says, "Hi, Dr. Earl. What area does axillary or subaxillary include?"
Great. Okay, so yeah, there's a little bit of confusion. It's like what's included in the back and what is not. Okay, and so the axillary area or subaxillary area is what we do consider an additional area, and it includes actually, even though it includes kind of 2 spots in the axilla, so that we can cover that entire axillary area. So it includes this spot right here. Okay, because sometimes there's a little bit of excess fat right in that area. And then, of course, all along here. So kind of underneath the armpit, lateral breast, this area here. So it includes this and this. Okay. And then the rest is pretty much covered by the back lipo. The only thing that you would have to add if you needed to, and most patients don't need this, would be if you have what we call the buffalo hump, which is all the way up here. That would be considered an additional area. But like I said, it's not so common. Most patients don't need that.
Doc, do you work on patients with previous tummy tuck and lipo work?
Yeah, of course. Actually, now that you mentioned tummy tuck, I actually recommend doing the tummy tuck first. So if you're thinking about BBL, but you have some skin laxity, or maybe you have some muscle separation, some weakness of your abdominal wall, it's much better to do your tummy tuck first, and then come back 3 to 4 months later to do your BBL. And then, in terms of patients that have had prior liposuction, I take that on a case-by-case basis. But it's not uncommon to do like a round 2 lipo or round 2 BBL as well.
Okay, this one I love it because the same patient is here on YouTube and here on TikTok, and she has the same question. Right. Is 19.6 BMI too low for a BBL?
Oh, it's getting pretty low. Yes. So I would say I typically we want to do like a BMI of 21 and over. Sometimes we can do BMI 20 if the patient does have some like pockets of fat that we can use. But yeah, I mean, you start getting a bit below 20, a lot of times we don't have enough fat to work with. So, but you're close. The good news is that you're close. If you're 19.6, I'm sure if you just gain just a few pounds, maybe 5 pounds or so, you'll get pretty close to 21, and then you'll be an ideal candidate for the procedure.
I was diagnosed with Lyme disease in 2016. Can I do liposuction?
So, without knowing anything else about you and assuming that you're now healthy, the answer would be yes. But there are a lot of caveats to that, right? I would have to know, what happened with your Lyme disease. There's some Lyme disease where the patients, of course, they get the Lyme disease, but then they recover and they do well. Other patients, they end up with cardiac issues that are longer lasting, right? So that's the case, and then we wouldn't be able to do it. So what would I say? I say, of course, we would need a clearance letter from your primary care doctor, and we would have to check your heart, check your EKGs, make sure that everything is functioning well. And if all that checks out, so your primary care doctor, your labs, your EKG, your chest X-ray, everything looks good, and we know that your Lyme disease is no longer active, then you would be a candidate.
Okay, this question has been around all the platforms and many times again.
Okay.
Can I do a BBL and a tummy tuck at the same day? So many patients ask like 10 times.
Yes. So that's a very, very common question that we get. And the answer for me is I do not recommend it. I would say no. Okay, I don't think that's a good idea, especially down here in Florida. Why? Well, first of all, we have some rules that are given, kind of some rules that are handed down to us by the Department of Health. So when you're doing surgery in an office-based setting like Pure, one of the rules is that if you're doing a tummy tuck, you can only remove 1,000 cc's of fat via liposuction. That's it. That's your limit. And that's not just for me. That's for that's for all surgeons down here in Florida. All right, no exceptions. So if you're removing only 1,000 cc's of fat, that's not a lot of fat removal. In most patients, that's what you can get simply by doing the flanks, and that's it. Not touching the belly, not touching the back. And then on top of that, you got to divide that in half, right? You got to take 500 cc's and put that into each cheek and hip, and so you're not going to have a big change there. So you're not going to get a lot of bang for your buck in terms of the BBL if you combine the procedures. The other issue is in terms of your recovery. So for a tummy tuck, of course, you have to be kind of flexed and laying on your back and your buttock. And for the BBL, ideally you'd be laying on your belly, okay, not putting any pressure on the buttock or hips. So something's going to get compromised. And so what is going to get compromised is the buttock and the hips. And so you're going to be putting some degree of pressure there. And there's going to be less fat survival. And once again, you're not going to be getting the bang for your buck that you need for your BBL. So I recommend separating those procedures. Do your tummy tuck first. Come back 3 to 4 months later. Do your BBL. All right, and that's going to give you the best and longest lasting results.
How long does a fat transfer takes?
So that's going to depend on several factors. How efficient and experienced your surgeon is, and basically the size of the patient and how many add-ons they might be putting. Okay, so of course you want a surgeon. If a surgeon has done a lot of these, so is highly efficient and experienced, that's going to shorten the time. So I can tell you when I first started doing this, say, 5 or 6 years ago, it would probably take me about 3 hours for like any BBL. And now, for the right patient, for a lot of patients, they can do it in an hour and a half or 2. Okay, and that's including with the ultrasound. The second thing is going to be the patient. So a higher BMI patient is going to take longer. So if your BMI is close to 30, it's going to take longer than if your BMI say is 20. So those patients where I take an hour and a half are typically the lower BMI patients between say 21 and 24 or so. And then the higher BMI patients, it gets closer to 2 hours sometimes. And then what can add a little bit more time to that? Any add-ons that you do. Say for example, you're adding arms and thighs and chin. Well, of course that's going to add more time. Or if you're adding body type, which is very common here, we use that a lot for skin tightening. So if you're adding, say for example, body tight to the arms and the abdomen, that's going to add a little bit more time as well. But I would say if you're asking me directly, on average, probably about 2 hours.
Okay, is a hemoglobin of 12 okay, given that I have thalassemia?
Right. So the important thing about thalassemia, is your hemoglobin level. So there's some patients that have thalassemia, it's a bit more aggressive, and they can't get their hemoglobin level to 12, no matter how hard they try. They can do iron, they can do transfusions, iron transfusions, and they just can't get it above a certain level, like 10 or so, and then you would not be a candidate. Now, if you have thalassemia, but maybe it's more mild for you, and you can get your hemoglobin to 12, then that would be okay. Then we can move forward.
Doc, you just received a cap. It's a present that's sent on TikTok. So it's your first badge or present.
Oh yeah,
Thank you
awesome.
to Aris Milis Morales.
Great. Is it a Duke cap?
No, I don't know. It's a TikTok cap.
Awesome. Thank you very much.
Okay, Doug, do you do awake liposuction or BBLs?
I don't. Okay, I don't. There's a few reasons for that. Okay. When you do liposuction awake, then you have to add, of course, numbing medication to your, what we call the tumescent solution, the solution that we first instill into the body before doing liposuction. What is used for numbing? It's a medication called lidocaine, very similar to the one that your dentist uses when they numb up your gums before doing dental work. Okay? The issue with lidocaine is that if you give too much, then you can have what's called lidocaine toxicity, and that can lead to cardiac and neurological issues that can become very, very severe. Okay? So that's one reason. The second reason is, it doesn't matter how much of that numbing you put in, and of course I just told you can't do too much because then you can get toxicity. The patient is never really that comfortable. And then I don't feel like I can really do what I need to do to get the best outcome for that patient. So for all those reasons, I don't do it awake. I use general anesthesia, and when I use general anesthesia, I use 0 lidocaine. So I eliminate that risk factor completely.
Okay, how long before surgery should I stop taking anti-allergic medication?
You may not have to stop at all. So it depends on the medication, but if you're taking something like, for example, like Claritin, that's okay. You don't necessarily have to stop that. So it depends exactly what medication it is, but if it's something like Claritin or similar, Benadryl, those are okay.
Can extra buttock fat on the inner lower buttock be fixed?
In the inner lower buttock. So you're talking about that area which a lot of people hate, which which I think sometimes, and I know it's not a great term, and I kind of apologize for this in advance, but sometimes we call it chicken butt, and it's that little area in that inner lower buttock which kind of hangs down, and of course a lot of people hate it. And I agree. It does. It takes away from the buttock. It's not aesthetically pleasing if you have that. So
chicken butt area.
Yeah, there we go. Perfect. So the issue is that it's not easy to take care of. We can definitely try to take care of it, but it's not that simple. It's not a matter of just going in there and kind of trying to suck that area out. You got to do several maneuvers to try to make it look better. So yes. Maneuver number 1 is you have to actually do liposuction to that area. You got to liposuction the area that's hanging down to reduce a lot of the fat that's in there. But the second part to it is that sometimes there's some attachments that cause that what we would call that herniation of fat into that area, and those attachments have to be released, and that release can become sometimes very, very difficult. And then you got a fat graft kind of around the area to try to smooth things in. And the last part is that sometimes when you do all that, the skin remains a little bit loose, and sometimes you gotta add something like Body Tight to that skin to then help that skin retract back up after everything is said and done. So not that straightforward. It's actually pretty challenging. I think a lot of times we can make it better, and in some instances significantly better, but it may not go away completely for everyone. Okay.
Okay.
All right.
Doug, and this is the last one.
All right.
How long does it take for skin to retract?
After, say, for example, so it's just I'm sorry, let me take that in 2 parts, okay? So if you have fairly decent quality skin, And we're doing, just liposuction alone, or BBL, but this refers to the part where we do the liposuction. Initially the skin kind of gets loosened up and then it's going to bounce back, but that's going to take, I would say, at least 3 months. At least 3 months, which is why we ask you to wear your garments for at least 3 months. Now, the most intense time period is going to be the first 6 weeks. So in the first 6 weeks, you're going to use your compression night and day, basically 23 hours a day. Okay? And then the next 6 weeks, or the following 6 weeks, you're going to scale down to 12 hours a day, but you're still going to be using that faja, okay, until you get to about 3 months. Now for the second part, what if your skin's not that great, not so much to the point that you need a tummy tuck, but still not that great, and you added body tight to your procedure? How long does skin retraction take after body tight or J-plasma? Similar. And that's going to take 6 months. All right, it's going to take a bit longer when you use the body tight or the J-plasma. It takes up to 6 months for that skin to fully retract. Okay? All right, everybody. Well, I hope that was helpful. Now you guys know. So please, take a a screenshot. All right, take a screenshot here. All right, how do you get to a safe BBL? All right, these are the things you got to think about: your BMI, healthy patient, hemoglobin level. Please check on your surgeon. Make sure see what board certification they have. Make sure they have a medical license to begin with. Their experience, or maybe you can check if there's a WAGS member. Make sure they're doing reasonable volume. Check the certification for the clinic. JACO, that's the best, but at the very least, Florida Department of Health. Okay. Anesthesia providers need to be experienced. All right. You don't want rookies for this procedure. It's a higher level procedure. Okay. Make sure that the fat transfer is only in that safe subcutaneous space, and that your surgeon is using ultrasound for the most safe that you can get. Okay. For that procedure. All right. Okay, everybody. Well, that's it for today. But I hope to see everyone next week on Hump Day with Dr. Alex Earl. We'll see you then. Ciao.